Hello, my name is John MacKay. I'm the clinical lead pharmacist in cardiology, and I work primarily with advanced heart failure, heart pump, and heart transplant patients. Today we're going to be talking about cardiac rehabilitation, as well as some of the cardiovascular medications that can help to improve your health. So why is cardiac rehab so important? Well, as a pharmacist, I'd like to tell you that I could give you one medication or one pill that would improve your overall cardiovascular health and everything would be fine. The challenge is that you have to actually go beyond just medications in order to get the best advantage to improving your health. Cardiac rehab provides you with several different things, but one, it's a team-based approach to helping you to get to the step that you need to be to improve your cardiovascular health. It involves providers, it involves nutritionists, it involves physical therapists, and a whole array of different providers that can actually get you in that best position to improve your health. Beyond just taking medications, it gets you to a shared responsibility for improving that health as well. It provides you with motivation, and again, provides you with more benefit than simply taking medication can do. And granted, taking medications is certainly important, but this whole team-based approach really is, in my opinion, and I think in the opinion of most of our providers, is the best thing in order to get you to where you need to be. So why are medications important? Well, we have, in cardiology, we're relatively spoiled. We have very large clinical trials that have shown us that certain medications are beneficial depending upon what sort of disease state you have. So whether it's high blood pressure, whether you've had a heart attack, multiple different disease states. We know that some medications can improve mortality, meaning they can keep you alive for longer, and certainly improve cardiovascular health and improve your overall outcomes as well. Again, those are disease state specific. Medications work best in combination with with lifestyle modification, with diet, and with exercise as well. So while medications alone can help to improve your overall health, this whole team-based approach is probably the best way in order to improve that health as well. Adherence. So why is adherence important? And defined, adherence is really remembering to take your medications at the right time, the right dose, and on a consistent basis. And that can be quite challenging, particularly in patients who have a very, very long medication list, particularly in our transplant patient population. They are discharged from the hospital with a very long medication list. So it can be quite challenging to remember to take all of those medications, whether or not that be 5 medications, 10 medications, 15 or more. How is it best to remember? Well, the best advice I can give you is try to make it a habit. Try to make it consistently part of your everyday routine so that you remember to take those medications. It's just like putting on your clothes in the morning. And what I've done is I brought a couple different examples of pill boxes, which I think are some of the better things to help you remember to take your medications. So this pill box we use primarily for our post-heart transplant patients. It's a very large pill box. It's got 4 different segments, so breakfast, lunch, dinner, and bedtime, as well as the 7 days of the week, Sunday through Saturday. And what's nice about this, it's got a clear lid, and you can slide it down. When you take your medications during the day, you can seal it back up. And you have seen, actually, you can tell whether or not you've taken those medications. And that's particularly important because I know I struggle with taking 1 or 2 medications a day and actually remembering if I've taken them. But if they are no longer there, you've taken them for the day, which is quite nice. And then again, you can go down to your evening doses. At the end of the day, seal it back up, you're on to your next day, and you can go throughout the week. We have something a little smaller. This one, very, very similar. It's only got 2 slots. This is actually particularly good for traveling. So you've got Sunday through Saturday, morning and evening, but the nice thing is, again, clear lids, one's green, one's blue. You can open it up, but you can also take the entire thing out. If you're traveling for the day, take this with you in your pocket. Remember to take it when you get home, place it back in here, and you're ready to go for the next day. Again, very, very similar, just twice a day dosing. And we have one other simple pill box, and this is if you only have a couple different medications you're taking once a day. You know, Sunday through Saturday, one clear lid, you can open it, close it, you know if you've taken it for the day, and you're all set. So again, several different systems really helping you to remember to take your medications and actually know if you've taken those medications throughout the day. So what happens when you forget to take a dose of medication? Well, in most cases, most medications are generally okay to take as soon as you remember, that be within a couple hours, 3-4 hours. Some medications, it becomes a little bit more complex, and that really depends on the medication. If it's almost time for your next dose, say you normally take the dose at 10 a.m. every morning and you realize you didn't take it and it's 7 a.m. the next day, generally you're going to skip that dose and resume your dose at a normal schedule. Certainly if there's any type of question at all, whether or not you should take the dose, contact your provider, contact your cardiologist, contact your pharmacist, see what the best advice can be. Some of these medications, certainly you don't want to stop taking abruptly because that can actually increase your risk of having a cardiovascular complication. So for example, some blood pressure medications, if you stop taking them abruptly, your blood pressure can actually increase. So we just want to make sure we get you on a consistent schedule. And if you do miss a dose and you find yourself missing several doses, it'd be a good idea to contact your pharmacist or your provider to come up with a better system of trying to remember those medications so you can continue to take them on a scheduled basis. Let's talk a little bit about blood pressure medication. So blood pressure has been referred to as a silent killer. So what does that mean? Well, some patients don't really realize that their blood pressure is high. There's no outward signs of having high blood pressure until you actually go in to get your blood pressure checked by your provider. And we know that high blood pressure has been linked to higher risk of cardiovascular disease. So you might have heard the statement before that the risk of cardiovascular disease doubles for every 20/10 rise in your blood pressure above a baseline of 115/75. Put in another way, so someone with a blood pressure of 135/85 is going to have twice the risk of cardiovascular disease as someone who has a blood pressure of 115/75. Similarly, if your blood pressure is 155, if the higher number is 155, you have 4 times the risk of someone with a blood pressure of 115/75. So clearly, keeping your blood pressure under control is a good way to decrease that cardiovascular risk. I've listed here several different medications. You might be familiar with many or all of them. These are different medications that we use to try to control your blood pressure. And again, depending upon what type of disease state you have, some of these medications are indicated, some of them may not be. So we'll just go through the list one by one. ACE inhibitors, names like lisinopril or enalapril, beta blockers such as metoprolol or atenolol, hopefully these are familiar to you. Angiotensin receptor blockers such as losartan or calcium channel blockers such as amlodipine or diltiazem. All of these different medications might be used depending upon what type of indication you have. Something to watch out for is low blood pressure with these medications, particularly if you've thrown on a bunch of different medications on top of lifestyle changes, on top of nutrition, all these different changes. You have to make sure that your blood pressure is not getting too low. Signs to watch out for: monitoring in terms of dizziness, lightheadedness. Certainly passing out is obviously a sign that something is wrong. Whether or not that be low blood pressure or something else, that's a sign you should probably go see your cardiologist or your provider. Again, all of these are a concern with low blood pressure. Hopefully, if we get you on a stable dose of these medications, your blood pressure will be low enough that it's decreasing your cardiovascular risk that it's decreasing your cardiovascular risk without increasing the risk of some of these other side effects. Let's talk about cholesterol for a moment. If you've had a cardiovascular event, a heart attack, or you've undergone bypass surgery, chances are your cholesterol either is high or it's not at the ideal level, and you're most likely going to be put on a medication called a statin or some of these other medications. Statins that you're probably familiar with, atorvastatin or simvastatin, names like Lipitor or Zocor might be familiar. Other medications like niacin or fibrates such as fenofibrate or gemfibrozol. All of these medications are trying to lower your bad cholesterol or potentially increase your good cholesterol. Now, what to watch out for with these medications? With statins in particular, we have to worry about, very rarely does it cause muscle breakdown. And the signs of that are really muscle pains, particularly in the big muscle groups such as your thighs or in your shoulders, things like that. Again, very rare, but if you do experience muscle pains, contact your provider or your cardiologist immediately. They might want to run some additional blood tests, and they might try to recommend a different type of statin or another medication altogether. In the news recently, there's been a lot of press about statins and the potential to increase diabetes, particularly at patients who are already at risk and have 2 or more risk factors for diabetes. What I will say is that we know that statins, in terms of overall cardiovascular risk reduction, we know that the benefits of statins far outweigh the risks of diabetes. So particularly if you've had a cardiovascular event, it's my opinion, and certainly in the opinion of most of our providers, that statins are more beneficial than harm, and they're very good medications to be on if you're able to tolerate them. Some of you may have had a heart attack and had a stent placed, which is basically a little tube that goes into your coronary artery to prevent that artery from reclosing. You are most likely going to be on aspirin for life, as well as another antiplatelet agent, and that varies based on provider. So it might be clopidogrel or Plavix, that's probably the most prescribed agent. Other agents include prasugrel or ticagrelor. And again, the reason for being on these antiplatelet agents is to prevent clotting and reocclusion of that vessel. Because they prevent clotting, we are at higher risk of bleeding. So those are some things you need to watch out for. Certainly any bruising that appears out of the blue or any bleeding that doesn't stop, that's something to be concerned about and notify your provider. How long you're continued on these medications is really dependent upon the type of stent that's placed, as well as other risk factors. So you might be on that Plavix or clopidogrel for 30 days or up to a year or longer, again, depending upon several different risk factors. So I would ask your cardiologist how long they plan on keeping you on the Plavix or the clopidogrel as well as aspirin. So in summary, cardiac rehab certainly can help you to decrease your overall cardiovascular risk, mostly by providing this team approach to your care and involving you in that care, as well as providers, nutritionists, as well as physical therapists and pharmacists as well. So all of this is aimed at decreasing your overall cardiovascular risk. And this, again, is a team-based approach, which I think is probably the best thing you can do in order to improve your health overall. Medication adherence certainly is important, but medications are just one piece of the puzzle. So in conclusion, again, I wish you good luck with your cardiac rehab, and if you have any questions, if you see me in the hospital or elsewhere, please come talk to me and ask me any questions. Thank you.